the new things that are coming up. I mean, they are rather old, but some new, things have come up. And so it is time to discuss these things and, increase sort of awareness of these concepts. So, of course, we know that blood pressure is one of the most dynamic physiological variables routinely measured in clinical practice, and it is characterized by continuous and significant changes from beat to beat, over 24-hour, day to day, and from visit to visit. So this is well known because sometimes patient comes, he is normotensive, sometimes he is hypertensive. So there is always this confusion whether the patient is what, and sometimes is very high blood pressure, sometimes not that high. So this variation is well known. But the importance is that if there is a decrease in nocturnal pressure variation, then it is the worst kind of prognosis. So that is also another important point to remember, that nocturnal blood pressure reduction is normal, but if it does not happen, so there is no drop in blood pressure at night, then it is a cause of worry. So this is a natural variation, and if it does not happen, so what I'm trying to say is that blood pressure variation is a normal phenomena, and it happens every day, and it happens from day to day, and even over the season it keeps happening. But if it is not happening, that it is a cause of concern. But the topic that I'm going to discuss is not no lack of blood pressure variation, but excessive blood pressure variation. And that itself is also a problem. So that is what I'm going to discuss. So for that, we have to know that fluctuations are a result of complex interplay between environmental, and as I talked about, seasons, altitude, stress, physical parameters like even posture and how much hydrated you are, and emotional factors like stress, which can induce blood pressure changes, and which can bring into play cardiovascular regulatory mechanism, the so-called blood pressure homeostasis. So, I mean, my point is that blood pressure variation is normal, but there are two extremes where there is no variation, especially at night, then that could be a problem, or if there is excessive variation, both of them are a problem. So basically, blood pressure variation is intended to ensure constant, adequate organ perfusion, and which therefore can change according to requirement of the perfusion. So whenever somebody is facing a physical or emotional stress, then the blood pressure can increase, and during the sleep, as we discussed, during the night, the blood pressure should drop. So these are normal variations. But from a clinical perspective, what happens is, when for a physician, this is a problem, because sometimes patient comes, blood pressure is high, sometimes it is not high. If they check at home, sometimes it is not high. So this causes a lot of confusion. And so one has to, bring out true high blood pressure in those situations. So that from physician point of view, it could be a problem. Moreover, increased blood pressure variation can be associated with alterations in cardiovascular regulatory mechanisms and also underlying pathological conditions, for which we have to be very careful. And one might say that, who cares for blood pressure variation? Why do we care for blood pressure variation? And I think that's an important question. And what has been found is that if there is a huge blood pressure variation between, and I will talk of the time frames, it is associated with increased risk of subclinical organ damage. So you might not even know that that organ damage is happening, and you might see people who come to you with the first time they are detected as high blood pressure, and you do an echo and you find a lot of left ventricular hypertrophy, or ECG shows a lot of left ventricular hypertrophy, and you are wondering, this is the first time patient has come and why that has happened. And this is because of blood pressure variation. If you are unable to catch this high blood pressure, then they may end up with this kind of problem. So there could be, without symptom, a subclinical organ damage with high blood pressure variations. But of course, there could be increased cardiac events. And not only events, there could be mortality associated with cardiovascular mortality also. And not only cardiovascular, but a stroke and total mortality can also increase with blood pressure variation. So basically, this is a very important area which was so far neglected, but it's now come to light that this is a very important area. And also interesting thing is that pharmacological treatment can modify this blood pressure variation. So there are certain drugs which if you use, you can bring down these blood pressure variations. So very quickly, I think what I've already discussed is that the blood pressure varies from beat to beat within 24 hours, and there are many mechanisms for that. The physiological mechanisms, there could be neural, there could be humoral, there could be vascular mechanisms, cardiac manifestations, rheological mechanisms, renal mechanisms, seasonal, behavioral, emotional, genetic, and treatment related factors. So these can all, for example, if you use short-acting drugs for blood pressure control, they can increase the blood pressure variation as you might expect. So these are all the factors that can happen in short term, but also in long term. Practically, these are the factors which can cause the blood pressure variation, especially the behavioral factors, the emotional factors. They can cause, even on long-term or mid-long-term basis, they can cause these blood pressure fluctuations or variability. And as I already discussed, some kinds of antihypertensive treatment also, where there is inconsistent blood pressure control, poor adherence to drugs, short-acting drugs, and dose omissions, and so on and so forth. And of course, environmental factor. So these are all kind of physiological problems, but there are certain pathological conditions also which are associated with blood pressure variation, which one needs to look into. The sleep-related breathing disorder like obstructive sleep apnea, carotid artery disease, arterial hypertension, chronic kidney disease, heart failure, diabetes mellitus, postural orthostatic tachycardia syndrome, and Parkinson's disease. All of them can cause a fluctuation in blood pressure. And basically, the impact of this fluctuation is that it affects not only the macro circulation, but also the micro circulation. So that is why it can cause so much organ damage, and it can cause events, morbidity, and mortality. Now, coming to the classification, I will say that these are 4 time frames where blood pressure variation is looked into. Very short, which is beat to beat; short term, within 24 hours; mid-term, day by day, maybe for a week you check; and then long, which is less than 5 years, and very long, more than 5 years. But coming to the important, what you look at, if you look at 24-hour blood pressure variation, you will always find that there is a nocturnal drop, and therefore always you will find a blood pressure variation. So that is why you have to be careful with that. Rather than using a 24-hour blood pressure variability, what you would use is a weighted 24-hour blood pressure variability. So weighted is the term which accounts for nocturnal and morning blood pressure difference, and then it measures it. Also, there is something called real average variability, ARV, which is a good measure of this. And there is something called residual blood pressure variability. What it does is, it takes out the long-term spectral thing and it looks at the short-term variability, and in the whole spectral analysis. These are all computer techniques, so you don't need to bother too much about them. Just know that 2 or 3 are more important than others. Now, implication, as I said, whether it is a beat-to-beat variation, whether it is short-term variation, whether it is mid-term variation, long-term or very long-term, all of them are associated with those things that I discussed: cardiovascular events, organ damage, cardiovascular morbidity and mortality, and stroke. All of these, and also renal. Remember, also renal dysfunction it can also cause. So these are all related. Again, very quickly I will say that 3 or 4 things are important in measurement: residual variability, weighted 24-hour standard deviation, and average real variability. These are important. Within the thing, nocturnal blood pressure variability is more important. So if you look at the whole day, if there is a variability in nocturnal blood pressure, too much variability, then that is more important. And 24-hour, as I said, is useless because you have to do a weighted average. And again, these events I already discussed, so I will not go into it. And this is the proof that there is a meta-analysis done which shows the relation between these parameters and the events rates. Then, of course, there are 3 types. Automated blood pressure has problems, home blood pressure has problems, but ambulatory blood pressure monitoring is the best. And so I will say between the systolic and diastolic variability is more important. And this is some, and but finally the effect of treatment, long-acting drugs, particularly dihydropyridine calcium antagonists, seem to be most promising. Short-acting are harmful, and adherence to the treatment, again, as I discussed, is important. So finally, I have to say blood pressure variability is a physiological phenomena generally, but sometimes it can be pathological. All components are independently associated. There are various ways to measure, but weighted 24-hour blood pressure measurement, the ARV and residual BPV are important, and long-term acting drugs like amlodipine can help in this situation. Thank you so much for your kind attention.
Thank you, sir, for your